Good evening, everybody. Welcome to the UAB Men's Health webinar, specializing in men's health issues after prostate cancer treatment. I'm Dr. Adam Baumgarten. We also have Dr. Patrick Self with us tonight. We are both reconstructive urologists at UAB. And what that means is we specialize in treating patients after cancer treatment, and one of those being prostate cancer treatment. Today, we'll be focusing on both stress urinary incontinence, which is bladder leakage, and also erectile dysfunction after prostate cancer treatment. We will have a chat box that you can see on your screen. Either myself or Dr. Self will be answering questions throughout the presentation. We also will have a question and answer at the end of the presentation. All right, so a little bit about myself. Like I said, I'm Dr. Adam Baumgarten. I did my medical training in Tampa at the University of South Florida. I also did residency at the University of South Florida in Tampa. And then I did a year of fellowship, which is a year of specialization in reconstructive urology and prosthetic urology at the University of Texas Southwestern Medical Center, which is in Dallas, Texas. I'm going to have Dr. Self introduce himself, and then he is going to get us started with talking about stress urinary incontinence.
Good evening, everyone. My name is Patrick Self. Like Dr. Baumgarten said, I am another one of the reconstructive urologists here at UAB. And I did my medical school not too far up the road at the University of Tennessee, and then trained in North Carolina for 6 years doing residency at the University of North Carolina, and then fellowship at Duke, where we did a genitourinary cancer survivorship fellowship. And like Dr. Baumgarten, spent an extra year training for dealing with a lot of the complications of cancer that some of you who are on this talk may be experiencing, and thus that's what brings you here. So we're going to talk a little bit about prostate cancer, and many of you have maybe heard a lot of this information from your urologist or your radiation oncologist, but we'll touch base on some of this, and then we'll focus here at first on urinary symptoms, specifically incontinence after surgery. So as many of you may have heard, prostate cancer is the most common non-skin cancer in American males, and it affects up to 1 in 9 men. Today, we estimate there's around 3 million men in the United States who are prostate cancer survivors. And unfortunately, while we've gotten really good at treating and curing prostate cancer, it does oftentimes leave our patients with urinary incontinence or bladder leakage, as well as erectile dysfunction. And some of you may have been through lots of different treatments or heard about various treatment options. Probably what you see most commonly are surgery, which usually comes in the form of a radical prostatectomy, which is most often done robotically these days. And then there is also radiation therapy, which can be done with beams that get shot into the prostate. And then there's also seeds that can be implanted in the prostate. And the occasional person might actually have both of those things done. And then there are some men who may take an active surveillance protocol where you don't necessarily get any treatment right away, but we're following you real closely to monitor your prostate cancer and deciding when and if we need to do any treatment. Certainly, there are pros and cons to each of these things, and we'll touch base on these here in a little bit. So we're going to focus now on stress urinary incontinence after prostate cancer treatment. And as we alluded to, this is the most common non-skin cancer. About 181,000 men are diagnosed every year, and nearly half of these men are going to undergo a radical prostatectomy. And this is an operation where we actually go in and remove the prostate. And as you can see in this diagram here, the prostate sits just under the bladder and then is connected to the urethra. So when you pee, your urine comes out of the bladder and goes through the prostate and then down into your urethra and then out the penis. So when you have a prostatectomy and you get your prostate cut out, your surgeon is then sewing your bladder back to your urethra, which is where your sphincter muscle is located. And depending how well or not well that goes, may lead men to having urinary symptoms after surgery. And while the good news is we see a lot of men who have improvement in urinary symptoms, specifically incontinence after prostatectomy, there still will be a solid portion of men who are bothered by their urinary incontinence after surgery. And in fact, what we see in a lot of men is the leakage is really bad right after surgery. And then really in the first few months, things start to settle out a lot. And we'll often tell men you may continue to see some improvement up to a year after surgery. Nonetheless, about 10% of men will still have bothersome urinary incontinence after surgery. And I think the good thing to know about this is that you're certainly not alone if you're dealing with it. And Dr. Baumgarten and I see it frequently in our practice. And I think for a lot of men, it can be embarrassing, especially when you get urine on your clothes or your pants, or if you're wearing pads and it soaks through it. And we see a lot of men who bring extra clothes with them everywhere they go, or they're at that age where they're traveling a lot. And frankly, I've seen men have to take an extra suitcase with them when they travel because of all the Depends or pads that they bring with them. Incontinence, as we mentioned before, is pretty typical right after surgery, but a lot of men are going to see recovery about a year afterwards. And for those men that don't see a good recovery, the good news is we do have a lot of options for treatment. And the reason that you end up getting urinary incontinence after surgery has to do with the way that our bladder normally holds our urine in. And the way this works is the prostate essentially functions as a sphincter muscle, which helps hold the pee in our bladder. And then we have a second sphincter that sits right below the prostate, and that's a muscle. And this is the one you might control, where when you're got an urge to go to the bathroom, or if you were standing in front of the urinal and you cut your stream off, this is that muscle that you can close to do that. And no matter how good your surgeon is and how hard they try, sometimes men end up with incontinence after a radical prostatectomy. And frankly, sometimes you can do the same surgery on two people and one man will have leakage and the next won't. But really what happens after a prostatectomy is that the sphincter that you're left with just isn't strong enough anymore to hold the urine in. So again, there are a lot of different ways that we can help improve leakage after surgery. And frankly, a lot of them don't require any surgery at all or any medications. You can use absorbent pads or adult diapers, and many of you may have heard this or be doing this as it stands currently. There are also catheter collection devices. Certainly are catheters that you can wear in the penis like you might have had after surgery, but there aren't many men who are excited about doing that. There are external clamp devices such as a condom catheter, and that's what's depicted in this picture here on the right. And this functions like a catheter, except that there's no tube going into the penis. So the nice thing about that, again, there's no tube going in there. You can control or contain the urine so that it's hopefully not getting on your clothes. The downside is you're wearing this clamp, and if that thing ever, or the condom, and if that thing ever accidentally slides off, or for some reason you have to change it, it's not really a reusable item. The other thing that we'll oftentimes see or recommend to people, especially soon after surgery, is this penile clamp, which you can see at the bottom here. And this really is essentially like a foam vise that you can put around the penis. It's nice if you need to use something, say, for an hour or so. Maybe if you go to church or go to the grocery store, or do something that's for a short period of time, you can wear this device and it can help keep you dry. The problem is you can't really use it for an extended period of time. It either starts to hurt, or we oftentimes don't recommend it for using a long time due to concerns about the blood flow to the penis there being messed up by leaving this clamp on there. The good news about them is they're fairly cheap. You can get them for about $30 on Amazon, and there's a lot of other websites that you can check out where you can order these things. Last but not least, your surgeon may also send you for pelvic floor physical therapy, or what you may commonly hear called Kegel exercises. And these are exercises that you can do really to help get you dry quicker after surgery. What we know about pelvic floor physical therapy is that performing it won't necessarily get you any more dry than someone who doesn't do the Kegel exercises, but it can help you get drier more quickly after surgery. So whereas waiting a year, you might be able to see your dryness come quicker if you regularly perform the Kegel exercises after surgery. And there are actually studies showing that it's helpful before surgery as well. I think something to keep in mind for any of you who may be doing this is pads or Depends. They're not cheap. And in fact, if you look at the cost of some of these devices over about 10 years, and I hear this a lot of times from a lot of patients saying how much money they're spending on pads, but you can see if you spend $1 a piece or 50 cents a piece, you're spending anywhere from $10,000 to almost $20,000 over a decade to pay for pads or diapers. Now, the options that we have that may provide a little bit more improvement in leakage in men who have this type of incontinence after surgery. Unfortunately, we don't have really good medicines that treat stress incontinence. And I never really touched on this before, but the type of leakage we're talking about here is, say you're out doing physical activity, you're working out at the gym, you're running, you're walking, or you're laughing, coughing, sneezing. These kind of things that stress your sphincter muscles are when you have this leakage after a prostatectomy. And so we really have two tried and true surgeries for this. The first one is this male sling that you see here. And this really functions like a hammock that wraps under the urethra and essentially supports your urethra and sphincter muscle in order to provide you or keep you more dry when you do those strenuous activities. The nice thing about it is that this device, after you get it put in, it works right away. So it'll fix your leakage right away. The problem is it's only good for a select group of men. It's not usually recommended in men who've had radiation. It's not going to be good in men who have really severe leakage. It's going to be good for men who have a more mild to moderate type leakage. And there are things that we help do to try to delineate. If you see us in the office or if we're examining you or talking with you, there are things that we try to get out of you and ask you to help us decide, are you a mild to moderate kind of guy? And would you be a good candidate for this? The device that's been around since the early 70s is this device called the artificial urinary sphincter. And this device has 3 parts. And essentially what it does is it has this cuff that you see depicted here. And this wraps around your urethra. So it essentially pinches your urethra off all the time, acting like a sphincter. And when you want to use the restroom or you get the urge, you squeeze this little pump. And this little pump sits inside your scrotum, in the front of your scrotum, and you give that a couple of squeezes, and what it'll do is pop that cuff open, and then you can pee and let the urine come out. And then this device automatically closes itself up over about 60 or 90 seconds or so. And this device is good for really any kind of stress incontinence, whether it's mild, moderate, severe, whether or not you've had radiation or not. This device can work very well for this. So there's a little animation here we just wanted to show you to get you an idea of how the sphincter works. So we're going to get this going here and take a look. And so what we see here with this device is it functions by having some salt water or saline inside of it. And that salt water compresses or squishes this cuff that you see back here. And then when you pump this pump in the scrotum, it moves the fluid out of it and it allows you to pee so that the urine can come out of the urethra here. And then what happens is the device automatically sends that fluid back the other way so that it then squeezes the urethra again. So you only have to push it in order to activate the device. And what we'll do next here, this is a little testimonial from a patient who's had an artificial urinary sphincter. So we'll get this going here and y'all can take a listen to what this patient here has to say.
I'm a person that believes in prayer, and I prayed about it, and I got stronger. And then I went and talked to the doctor, and I found out about the artificial sphincter. And when he explained to me what it did, I wanted it. And what happens is with the artificial sphincter, you wind up with a bulb, I call it, in your scrotum. But it holds your urine until it's time for you to go to the bathroom. And when you go in, you push the button, you release, and then you're back to normal. I mean, it's something that's hidden. No one knows that you have it. But it took me from 9 pads a day down to 1. I wear 1 pad because I like to laugh. And laughing, sneezing, coughing, or lifting something sometimes will cause you to drip. And I do wear different color pants. I used to wear just black and dark blue, so when I had an accident, nobody knew it. So because I wear different color pants now, and a lot of times lighter pants, I don't want my pants to be wet from the drip. I wear 1 pad just for the safety and for the comfort. And it works real well for me. I'm not trying to be perfect, but I'm just trying to be comfortable. And it does make me comfortable. And it makes me feel as though I can do the things that I want to do with the confidence of not having to worry about whether or not I'm going to wet on myself.
And I think one thing Dr. Baumgarten would probably see in his practice as well, and this patient here alluded to, are that a lot of men feel stuck at home by their leakage. And I've seen plenty of people who've stopped going to church. They've stopped going out because they feel stuck at home. And some of these devices can really change their lives for the better. And like this gentleman said, I think neither of us would ever promise anyone will get you 100% dry. But we can make a significant improvement in quality of life. And what we sometimes see actually with these devices, and I've had this happen before, is if for some reason the device stops working, the man will give you a call and say, something's going on. I need you to fix this tomorrow, because that's how much it improves their quality of life. And so these devices are both outpatient surgeries. You can come in and go home the same day after them. All the components of both of them are completely inside the body. There's nothing that anybody sees on the outside. And the good news is with these devices that we do have long-term data showing that these do work, and they continue to work over time. Now, certainly both of these surgeries would have potential risk to them, and we've listed some of them here. Not every single one of them is listed here, but some of the particular things you might see with the sling device is, again, it doesn't always work for everyone. And so we try to pick the right people who are good candidates for this before we would offer it to you. There's a very small chance of having difficulty peeing after surgery. And some guys will have to leave a catheter in for a few weeks, or you'll have to pass a catheter on your own until your bladder sort of heals up and recovers after it, but it's usually very brief. It's rare to have any of these other things like irritation at the wound site or a real severe reaction to the sling. Those are fortunately very uncommon. The artificial urinary sphincter device, one of the things that you can see is you saw in the pictures, it has moving fluid through it. Sometimes that fluid can malfunction for some reason, or the device can break and spring a leak in it. And that would require another surgery to fix. So that is a possibility with this sphincter device. We occasionally do see men have difficulty peeing after this. Fortunately, very rarely we see men get an infection, but if it does, unfortunately, that means the device usually needs to come out. But again, it's very rare. And then in some men, you can see what's called erosion of the urethra, where the device actually eats a small hole in the urethra over time from squishing it. And the good news is that is fairly uncommon as well, but we can certainly treat that if we need to. Overall, what I would say is that stress urinary incontinence is one of the most common things that we see after prostate cancer treatment. The good news is there are a variety of options, some of which are non-surgical, some of which are surgical. And like we mentioned before, we do have this sling and artificial sphincter device, which can be good for men who are tired of using pads or condom catheters, but certainly those options are good for patients as well. So I'm going to turn it over to Dr. Baumgarten now and let him talk a little bit more about erectile dysfunction after prostate cancer.
Thanks, Dr. Self. I'm going to, everything Dr. Self said, I completely agree with. One question that I do get a lot in clinic about these slings, these are completely different than the slings that you've seen on all these lawsuits for female patients with prolapse. This is a completely different material, completely FDA approved, and you don't need to worry about the safety from that standpoint. And one other thing that I'll add, and I think Dr. Self will agree with, these are some of my favorite patients to see in clinic because I know how much of a difference I can make so quickly in these patients' lives. And these are some of my happiest patients after you treat their incontinence, bring them from wearing 9 pads or wearing diapers to wearing one protective pad or some no pads. So definitely, if this is something you're experiencing, we're both here to help you. Next, we'll transition to erectile dysfunction after prostate cancer treatment. As you can see here, this is the same diagram, but the nerves that provide stimulation for an erection lie very close to the prostate. You can see these yellow nerves that sit right under the prostate, and these can be injured, obviously, during what you see here, prostatectomy or removal of the prostate, or also during radiation. Typically in patients who have a prostatectomy, we see erectile dysfunction right after surgery. They're going to experience issues with their erection right after the prostate comes out. And some of those patients will have recovery over time. As opposed to radiation, typically men after radiation, their erectile function's okay, but after a few years, it slowly deteriorates and deteriorates. Looking at some of, how many people have erectile dysfunction, looking at patients just not necessarily with prostate cancer, but just your average patient, 1 in 4 patients will experience erectile dysfunction. Looking more at our prostate cancer population, up to 46% of men will have some form of erectile dysfunction after prostate cancer surgery after 1 year. And then after radiation, up to 50% of men will experience some form of erectile dysfunction. So this is very common, and I imagine a lot of you are experiencing this. Prostate cancer the treatments can affect the nerves and also the blood vessels that help elicit erections. It can take up to a year to regain sexual function, and sometimes a little over a year to regain your sexual function after prostate cancer treatment. So a lot of times after prostate cancer treatment, especially prostatectomy or prostate cancer removal, we will do something called penile rehabilitation or penile rehab. And what that involves is giving you like Viagra or Cialis medication, and some men will also use a vacuum erection device to help promote blood flow to the penis and help hopefully erections come back. If the ability to have erections doesn't recover, we do have treatment options that can reestablish that spontaneous sexual relationship. The first therapy that we typically offer that many of you may have heard of are PDE5 inhibitors or pills. This is your Viagra or Cialis, and these have now gone generic now, so now they're sildenafil or tadalafil. The good news about them going generic is they're much cheaper. Where they used to be about $30 a pill, you can get them for under $1 a pill now. There are some misconceptions with these medications. One, these don't just give you an erection automatically. You still need sexual stimulation for these medications to work. We advise patients to take these pills at least a half hour to an hour before anticipated sexual activity. Certain patients are not candidates for these medications, and especially patients that are taking nitrate medications for chest pain or certain heart conditions cannot take these medications. And these medications will work for some patients, but not for everybody, unfortunately. Potential side effects include headaches, facial blushing. Some patients will get some muscle aches, and some patients will see kind of some visual disturbances. Usually they can see a blue hue in their vision for a short period of time, but these are all temporary side effects. Next is what we call vacuum erection device therapy, which a lot of you have probably heard of. And this is basically placing this vacuum device on the penis, and you have something that facilitates bringing blood into the penis, as you can see in the top picture here. And then on the bottom picture, you can see a ring is placed at the back side of the penis that traps the blood in. Benefits of this type of therapy is you can use it on demand. It's safe and effective. It doesn't require any drugs or surgeries. And, once you buy the device once, it's, you have it, you don't have to keep paying. It's pretty cost effective. But there are some disadvantages. A lot of patients complain of pain or discomfort. Some men say that the erection is not warm to touch, but it's kind of cold feeling and doesn't feel very natural. And a lot of men won't experience ejaculation with this type of erection from this type of device. Next is penile injection therapy, or what we call intracavernosal injection therapy. And what this is injecting a medication into the penis to elicit an erection. Unlike the pills that we offer, this will give you an erection automatically, even if you don't have sexual stimulation. Benefits of this is it doesn't require a surgical procedure, and it works for a lot of men that the pills don't work in. Obvious disadvantages include you got to stick a needle in your penis every time you want to have an erection. Some men will have an erection that lasts more than 4 hours, and they'll have to get that treated either at the emergency room or in our clinic on an emergent basis. But that is pretty rare if you take the precautions that we give you on how to use these medications. You can't use these medications every day because it can cause too much trauma to the penis. We typically say you can use it up to every 2 to 3 days. It can cause some bruising and pain. And a lot of men just have a fear of sticking a needle in their penis. And lastly, we'll talk about the inflatable penile prosthesis. This is a device that we place surgically that's placed completely within the body. And it, like it says here, it's totally concealed within the body. And its goal is to mimic the natural erection. So in its normal state, it is flaccid, just like a normal flaccid penis. There's a pump within the scrotum that you pump up, and as you pump it, the penis will become hard with fluid that you can see in the reservoir in the top right of this picture. And I'm going to show you an animation in a minute. And this acts and feels more like a natural erection. The penis expands in girth, and when it's soft, it feels like a normal, soft, flaccid penis. The big thing about this type of therapy, it really reestablishes spontaneity. You don't have to worry about, hey, is this pill going to work tonight? Or, hey, is my shot going to work tonight? Or I need to run to the bathroom real quick and give myself a shot and hope I get an erection. This is going to work every time. You can use it as many times as a day as you want. And once you pump the device up, it'll stay up as long as you want it to until you take it down. And we'll get into some of the questions that we hear a lot about: sensation, orgasm, things, partner satisfaction in a minute. But first, I'm going to show you all a video on exactly how this device works. So as you can see here, this is a 3-component device. There is a pump, there's cylinders, and there's a reservoir. As the patient pumps this pump, there's fluid being transferred down into the cylinders, making the erection erect, or the penis erect. When the patient is done with any sexual activity, he pushes a button and the fluid is transferred back into that reservoir, and the penis gets naturally flaccid, like a natural flaccid penis. All of this is contained within the body. So, looking from the outside, no one will know that you have a device in, and the prosthetic gets very, very rigid, just like a natural erection. Before we get into some of the questions we get on this a lot, I'll play a patient testimonial that we have here about a patient and his partner that have experienced a lot of the things you all are going through, and that has an inflatable penile prosthesis.
We started off with Cialis, the low dose, where you take Cialis every day. No effect whatsoever, none at all. Then we tried Muse. I tried that in the doctor's office, and that gave me a nice warm feeling, but did nothing else for me. Then the doctor suggested shots, but I said no, I was not sticking a needle in there. And then we tried the vacuum erection device. That sucker works. That worked really well as far as size and stiffness. Oh, absolutely. It was uncomfortable, and Marcia did not like it. And the rubber bands that you put on to maintain the erection were extremely painful for me to take off. They were two very tight rubber bands. And there was always the danger of falling asleep afterwards. But to actually perform the job, it worked very well.
I didn't like the vacuum pump, but it did do the job. It was no romance to it because you had to pump yourself up. Well, that's not any fun for you to watch and do. And then when he would take it off, it was painful. So you lost all that good feeling that you had. And then you had to do the sterilizing and drying of it, which was not fun either if you have neighbors that might pop in, having that on your counter.
And then I got a letter to one of the seminars, the patient education seminars that they do. And I went there and listened to the doctors make their presentation, and also other patients who had the prosthesis. I thought it might be a good idea. Marcia and I discussed it at some length. The thing that held both of us back, probably held Marcia back more than me, was the idea of having an operation again. Marcia couldn't face the thought that she might have to go through another 3 or 4 months of what she had to go through with me after my last operation. So it was pretty bad. And it wasn't. The operation is so simple and so easy. And recovery, I took pain pills for 3 days, and I thought I didn't take pain pills. And to me, it was great.
His urologist told me something that was very important. He said, Marcia, he's not doing it for you. He's doing it for himself. He needs to feel whole again. And I think that's what really set me over to agree with him.
All right. So, a lot of questions that we get about penile prosthesis. Is my sensation going to be the same? Am I going to be able to orgasm when I have with a penile prosthesis? What does it feel like for my partner? All these are the answer is it'll feel the same as a natural penis or prior to your prostate cancer surgery. You'll still have sensation. You'll still orgasm. Obviously, if your prostate has been removed, you won't ejaculate like you would have prior to your prostatectomy, but you'll still have the sensation of orgasm. It'll feel like a natural penis to your partner. There's been studies that have looked at patient and partner satisfaction, and they're both well above 95% with these inflatable penile prosthesis devices. This surgery is done as an outpatient surgery, so you do go home the same day. And typically patients are using their prosthesis within 6 weeks of it going in. So there obviously is a healing process, but by 6 weeks, most patients, and some well before that, are using their device. Just like the surgeries for incontinence and any surgery in general, there are risks. The biggest risks for putting a penile prosthesis is the risk of infection. In patients who are not diabetic, the risk of infection is anywhere from 1% to 2%. We do a lot of things to help mitigate the risk of infection or decrease the risk for infection, like checking your urine before surgery to make sure there's no infection and giving you antibiotics. Some of the devices are like the device we presented here is coated in antibiotics. And these all have greatly reduced the risk of infection. There is a risk that the device will malfunction. Most of these devices will last at least 10 years. So 90% of the devices that we put in, of the inflatable devices, last at least 10 years. And that doesn't mean that your device is going to stop working at 10 years. It just means that of all the studies that have been done, it looked at men at 10 years out, and 90% of those men still had a working device. We get a lot of questions about insurance, and Dr. Self and I aren't the people that manage the insurance. However, most of these are covered, are slings, artificial urinary sphincters, and penile prosthesis are a prescribed therapy, and they're covered by most major insurance plans. We have a team that can go over all the insurance questions that you may have if you do have questions that this is the route you want to go. And you'll never get stuck with a surprise bill. We always, you would know if you were going to owe anything prior to surgery. But most major insurance plans, including Medicare and Blue Cross Blue Shield, most of these will cover these types of surgeries. So this slide, if you all are interested in getting an appointment with either me or Dr. Self, I'd like you to send an email to this email address here with your name, phone number, date of birth, and reason for the appointment, whether it be incontinence or erectile dysfunction. If you do this, we will do our best to get you within the next couple of weeks since you watch this webinar. Alternatively, if you don't want to send an email, you can give us a call at this scheduling number and go through the main UAB urology scheduling number. However, if you do go through the email, you will get some quicker response, most likely, and quicker appointments. With that, I will open this up to any questions. And Dr. Self, if you have anything you'd like to add, and if not, Dr. Self and I are more than happy to help you all through this journey of recovering after prostate cancer. And we're both here for you.
Yeah, thanks, Adam. I think what you've heard from us tonight and that we touched on are probably the two most common things that we see after prostate cancer, and that is the erectile dysfunction and stress incontinence. But certainly some of you may be dealing with other things as well. Somebody mentioned in the comments they were dealing with a urethral stricture. That's a blockage in the urethra, and that can happen after prostate cancer surgery or radiation. We see men who have problems with bleeding from their bladder after prostate cancer. We see men who may get holes in places they're not supposed to have holes. We also see men sometimes get blockages from the kidney draining down to the bladder. And fortunately, these problems tend to be less common than the incontinence or the erectile dysfunction, but there's certainly things that can be life-altering, and we can deal with those things as well. And so while we didn't go into them in detail tonight, certainly if you're dealing with those things, we are happy to help out with those as well. And scheduling an appointment with us, we can discuss and go over those things also. I think for any of you who don't live near a clinic, we have telehealth visits as well. So we sometimes can do video visits with folks who have difficulty with travel. I will say a lot of times it's nice to see folks in person to be able to do a good exam, especially when we're talking about leakage, and really then also going over the penile implant. It's helpful to see.
Dr. Self, I think you froze up. We just got a question on mild to moderate incontinence and what is the definition of that. We do take a lot of different factors into account when we look at defining your incontinence. One being, and the biggest being, how many pads are you wearing a day? How saturated are those pads? That would definitely be the biggest. Others are you able to start and stop your urinary stream on your own? That would be a marker of mild to moderate incontinence versus severe incontinence. And then, a lot of patients that are dealing with incontinence will perform what we call a cystoscopy to look at the anatomy to see if we can offer you a sling or if you would be a better candidate for a sphincter. I'll leave it open for another minute or so, and if there's no other questions, I will end the webinar. I think Dr. Self just texted me. He asked his internet dropped. And if there's no other questions, thank you all for attending. And like we both said, oh, here we go. How soon after surgery can a penile implant be placed? It really depends on the patient. We've had some patients that have experienced erectile dysfunction before surgery. So in those patients, we tend to push, and if they are interested in an implant, we can place them up to a couple months after surgery. I tend to push men who had normal erectile function prior to surgery. I like to say you should wait around a year. And at 1 year, if you're still having issues with erections, we could talk about doing a penile implant. And the same goes for a sphincter or a sling. Typically, we wait for around 1 year and then start talking about surgical options. There's a question here. about Kegel exercises and will they work to eventually get one back to a normal state. Sometimes they will. However, in about 10% of men, the patients will not get back to that normal state, even with Kegel exercises. And those are the men we talk about treating with these types of devices. We have a question about length and girth after penile prosthesis placement. So this is an interesting question. We can't make your penis bigger, but we can maintain whatever length and girth that you have at the time of when we do the surgery. And this is why some people, we say, if you continue to lose length and you're not getting good erections, it may be time to consider a prosthetic because it will maintain the length and girth that you have, but we cannot make your penis bigger. There's a question about radiation and sling placement. And unfortunately, patients who have had adjuvant radiation are not good sling candidates because the data shows that patients that have had radiation, slings just don't work very well. And we push those men to consider artificial urinary sphincter. There's a question on why do some patients go through one diaper some days and multiple diapers another day. This can be from a lot of different reasons. One can be from fluid consumption. Another could be from activity you're doing that day if you're very active. The things we're talking about here are stress related, whether that be coughing, sneezing, working out, things like that are going to make you leak more. If you drink more fluid, obviously you're going to have more urine to leak as well. This gentleman's talking about penis shrinking after prostatectomy. We do see a lot of loss of length after prostate cancer treatment, and that's because men are not getting good erections for quite some time. And the decrease in blood flow can make can cause penile scarring and penile shortening, and that can cause loss of length. So I'm just going through all these questions here. There will be a video available for review that will go out to all of you that attended tonight. A patient's talking about can we implant both a artificial urinary sphincter and a penile prosthesis in the same patient? And the answer to that is definitely. Typically, we don't do them at the same time. And in my practice, and I think in Dr. Self's practice, usually we start with the artificial urinary sphincter because men deal with incontinence on a 24/7 basis. And obviously, people aren't having sex on a 24/7 every second of the day. But we can definitely, patients are candidates for both devices. Usually we just do them in a staged procedure. A patient's asking about potential for nerve healing after a prostatectomy. And a lot of that goes into the degree of cancer that you had, how severe it was. Did your surgeon do a nerve sparing operation? And also some of your other comorbidities, diabetes and other things that can lead to erectile dysfunction. So that's kind of a loaded question. But typically we say after about a year, if you're not having good erectile function, we should start considering some other types of treatments. You can also have a sling and penile implant surgery. We typically do those in a stage fashion as well, although some people would do those at the same time. However, we have found that there are probably better outcomes if you do these in a staged fashion. Someone's asking, I think Dr. Self just answered, patients who have diabetes, can they get a prosthesis? The answer is yes. One of the most common reasons for erectile dysfunction is diabetes. However, we need to make sure that your hemoglobin A1C, or your marker of how well your sugars are controlled, is good. So your hemoglobin A1C needs to be, everyone has different cutoffs, but your sugars need to be controlled, and we can talk about that in clinic to see if we need to better control your sugars, or if you're a candidate at that time. Dr. Self and I both perform many of these implants every month. Someone's asking about how many of these we do. We both do multiple, both penile implants and artificial urinary sphincters and slings. we're both fellowship trained in this and feel very comfortable doing these types of procedures. There's not any other questions. We'll end the webinar. I'm sorry if I missed your question. There was a lot of questions being asked at once, but we're happy to discuss, in clinic or over a telehealth appointment if we missed anything. And again, thank you so much for attending, and we look forward to helping you in clinic. Have a good one.